Hello, and thank you for joining us here on blackdoctor.org. I'm your host tonight, Shamika Rhymes. Let me know in the chat where you are watching from and how you're doing this evening. Well, November is Lung Cancer Awareness Month, and so we are focusing on lung cancer in part 2 of our Lung Cancer Awareness Special. And so please go check out part 1, and you can find that either right here on blackdoctor.org's Facebook page or on the YouTube page. So, lung cancer is one of the leading causes of cancer-related deaths. It's a disease that's often misunderstood, and it affects thousands of people every year, but it's especially important for our community to be aware of the risk factors, early symptoms, and life-saving screening options. So we have an expert panel who's here tonight to guide us through all of this crucial information that you need to know about lung cancer prevention, detection, and the barriers that still exist in access to screening. So we'll be addressing your questions throughout the show. So make sure you drop your questions in the chat, and we'll try to get to all of those if we can. So let me introduce you to our panelists tonight. So tonight we've got Laura Haracha. She's a registered nurse with the American Lung Association. Hi, Laura. Welcome. Thank you for joining us.
Hi, thank you. Happy to be here.
Dr. Mark Widman. Oh, thank you. Dr. Mark Widman, he's a thoracic surgical oncologist. He's the chief of thoracic surgery at Morristown Medical Center and the director of the lung cancer program at Atlantic Health System. And I believe he'll be joining us in a little while. And Dr. Sarah Gandahare, she is the medical director of outpatient pulmonary, sorry, I can read, rehabilitation at Cedars-Sinai. And Denise Lee is here. She is a lung cancer survivor. So welcome. Thank you for joining us tonight.
Thank you. Thank you for having me.
Let's see here. So again, anyone in the chat, drop any of your questions as we go along through the night. So the first question, and this is a question I'm going to pose to all of you, why, and anyone can start, but why is lung cancer an important health topic for the Black community? Who wants to start?
I can start.
Okay.
Well, thank you so much for having me. I really appreciate the opportunity to join the group and have a chat. And I think it's an important topic to talk about for every person. As you alluded to earlier, the impact of lung cancer is pretty significant. Lots of people get it. Actually, every 2 minutes, somebody in the US ends up with lung cancer. So by the end of our hour, 30 more people will join the group that have had lung cancer. And so how that impacts the community as far as cancer goes, lung cancer goes, it's all aspects from early detection to opportunity for treatment, as well as the type of treatment that is received in the Black community that has been impacted. And so it is really important that we talk about it, we identify barriers, we figure out why is it that there is that disparity that exists, and so there's lots to impact there.
Thank you. And thank you for joining. I kind of lumped all that in at once, but thank you again for coming. Doctor, am I saying your name right? Widman, is that how you pronounce it? Oh, I can't hear you. Okay, let's see. I think I might be able to hear you now. Oh, wait. Okay, let's try. No. It may have been because you had your headphones on. I don't know. Can you hear us?
I can hear.
Mm-hmm.
I can hear you, but
Okay.
you can't hear me.
I hear you.
We can hear you now.
We can hear you now.
Okay, this is better. Okay.
Okay.
All right, I'll stay with the headphones then. Thank you.
Okay. How do you
Thanks
pronounce
very
your
much.
last name?
Widman, you were correct.
Widman. Okay. So thank you for joining us tonight. We were just getting started and talking about why lung cancer is an important health topic for the Black community.
So I can add on to what was said by the doctor. So I think lung cancer is such an important topic in the Black community because a lot of the disparities that are in the outcomes So, Black Americans are more likely to die from lung cancer than other racial groups due to later stage diagnoses, as well as limited access to care or just other barriers to care that might be.
Yeah, I think you hit it right there. That I think you see the racial disparities most striking in the Black community compared to the white community, and at the end of the day, there's a lower survival in Black patients who are diagnosed with lung cancer, but a lot of that stems from the upfront access to screening and basic services, where I think the biggest impact can be made on lung cancer survival by early diagnosis. And Black patients are much less likely to get screened, and there's a variety of reasons behind that, and some of which can be very readily changed potentially with a lot of awareness. And some of it is baked into the screening criteria, are not as sensitive to Black patients' needs as white patients' needs. And that I would refer to that it's only recently that they've lowered the criteria of entry into screening to be 20 pack years. But traditionally, I think white patients smoke more than Black patients, but that doesn't mean your risk of lung cancer is definitely, lower. In fact, it really probably has more to do with duration of smoke exposure than the actual volume of the smoke. Now that, maybe translates to differential rates of emphysema and other things, but if you're talking specifically about lung cancer survival, probably the number one thing that would change outcomes starts with screening and identifying early stage patients. So they need to be offered screening opportunities at wellness checks. That's where that begins. They need to have access to screening studies, and the screening criteria probably need to be even adjusted further. There's some issues I have with all races in terms of what the screening criteria is, because I think there's one thing in a lot of the screening criteria that says if you quit within 15 years, you're no longer eligible for screening. And that just doesn't make intuitive sense at all, since I would say 90% of the people I operate on for lung cancer cure quit smoking over 20 years ago. So they wouldn't even fit into the criteria, based on that alone. Now, there's a variety of ways, that can be addressed, but it's most distinct in the Black Americans. Decreased screening, decreased access to quality surgery centers, so they're not referred to surgery as often as white patients and Hispanic patients, and there are disparities within every group at one level, here or there, but it's most pronounced in the Black community, having decreased survival, and I can't emphasize enough the need for screening and access and promotion, and being able to send that message in a variety of ways, maybe not just at the doctor's office, or maybe when they're getting other medical care, to emphasize it, not specifically for lung wellness checks.
Thank you. And Denise, from a patient perspective, why is lung cancer an important topic for the Black community?
Well, I think to echo something or what Dr. Whitman just said, we don't have the same access. My primary care physician did not refer me, even though she stayed on me for about 20 years to quit smoking. She never referred me for screening. And I actually didn't even know anything about low-dose CT scan for early detection of lung cancer until I was driving home from work, and I saw a billboard about low-dose CT scans. That's how I found out about it. Oh, wow. And it saved my life, because they were able to find it early. They originally thought that it was a 3A or B, and then after my surgery and my the pathology, it was, I guess, downgraded to a 1B. But early detection saves lives, and I'm definitely an example of that. But I think it is the access. I know that I had very good medical care. I live in the Bay Area, so I had access to some University of California, San Francisco. I had access to Stanford University. Some medical care. So I was in a much different position. I will admit or tell you that I had two cousins that were diagnosed with lung cancer. One was diagnosed a year to the day after I was diagnosed, and another one was diagnosed probably about 2 years, and both of them died. And I know watching their treatment, they did not get the same treatment that I got. They weren't referred for the same things. They didn't even have the same testing initially. So I got an opportunity to see up close and personal the distinctions that are made either between, I had great medical care, medical insurance. So I mean, there is a disparities, and I saw it up close. So that's where I am.
Okay, thank you for sharing that. What are some common causes of lung cancer, and who is at risk? I think Dr. Widman, you kind of mentioned it, and so did Laura and Dr. Gandahari. Can you kind of add on to that if there's some other common symptoms that people should be on the lookout for?
Well, I can start with smoking is traditionally associated as the highest risk of contributing to lung cancer. But we're finding more and more of those who have actually never had exposure to cigarettes, either firsthand or even through secondhand exposure. So it is important to look at all risk factors when it comes to lung cancer. In addition to cigarette use, as I mentioned, secondhand is people who were born in households with parents smoking at a young age. They were exposed to it early on. And then we're also finding other things such as radon, which is not something that people are familiar with or hear about it routinely, but it's actually present quite a bit, and it's thought to be the second highest reason for getting lung cancer. It is a radioactive gas. It's naturally occurring. It forms in rocks. It could be under all of our houses. Some areas have more than others, but the way that it builds up is if your home doesn't have enough air movement, airflow, it can build up and can potentially increase the risk. And the only way to know is there are these kits that you can purchase. They're not that expensive, $20, $30 to figure out if the amount of radon is high in your home. And the fix isn't that you have to leave or move your home. It's just that you have to figure out some sort of circulation of air within that space, in particular those places that have basements, etc. There are other factors. Our pollution, our air is terrible. So that is another factor that we have to keep in mind, that if we live near a freeway, that we are in an urban environment exposed to just normal air pollutants, it adds to it. And of course, there's factors that we just don't know, whether it's family history or other exposures. We do not know as to what is contributing to it. We're learning more and more, but those are the big factors that come into play. And then the whole aspect of vaping, which at this point is more and more becoming used, but we don't have long-term data to support one way or another as far as their safety.
Okay, thank you. Laura?
Another thing I wanted to add about smoking and why it's so important to talk about lung cancer in the Black community is because we know that the Black community was targeted by tobacco industries. So there's just a higher smoking related risk, and that has contributed to, the higher rates of smoking related lung cancer in the Black communities.
Okay, thank you. Dr. Widman.
Don't have a lot to add in terms of signs and symptoms, in the sense that where the biggest impact of our effort is going to be made is on detection of asymptomatic cancers. Unfortunately, when many patients are diagnosed and they have symptoms, which could be chest pain or coughing blood or can't get rid of an infection, they're already at an advanced stage, and their long-term survival is going to be pretty limited. And that generally drives people to the doctor when they have those symptoms. But your big impact is really finding the patients who are asymptomatic, and that early detection with the screening CAT scan. Probably 80% of the tumors that you find are early stage, and the vast majority of those patients can get successful treatment for curative intent and actually get cured, as opposed to if they're presenting with symptoms when it's unfortunately often too late.
Okay, thank you. What types of screenings are available for lung cancer? I know Denise mentioned the one she had. What are the other types of screenings that are available that we may not know about?
The low-dose CT scan that Denise mentioned that she saw on the billboard, Saved by the Scan, is really the main form of lung cancer screening. Over the years, there has been we've looked at chest x-rays, which is just a plain x-ray. That hasn't really shown that it would be enough, or by the time that you are seeing it on the chest x-ray, lung cancer would be already too big and too far advanced, and is not going to change the outcome if you're seeing it by that point. In the past, they've used sputum and looked at the sputum samples, but really so far, the main way that we're screening for lung cancer is to just get a good history and just make sure that there are no symptoms that are as Dr. Whitman described, as far as those that are associated with potentially lung cancer, but also getting a detailed history of tobacco use and potential other exposures, and the low-dose CT, which is, in a sense, it's actually pretty simple and easy. And I hope Denise can speak to this about how easy it was for you to get that scan. But it really shouldn't take that long. And what it does is you get really cuts of the chest to really get small samples of the entire chest and look for small nodules, which are these spots in the lung that can tell us potentially, could there be something that maybe a cancer that's growing or not.
Okay, thank you. Well, Denise, would you like to share a bit about your journey and share your experience with the CT scan? And again, you mentioned earlier how seeing that billboard saved your life. So can you just kind of walk us through your journey?
Sure. I actually had just quit smoking probably about 9 months prior to this getting the scan, and I didn't have any symptoms. I had gone to my primary care physician after I'd seen the billboard, and I asked her to order it, and she said I didn't qualify. And so a couple of months later, I went back for a totally unrelated issue, and I said, "Oh yeah, by the way, I do think that I qualify for this scan, and I really want you to order it." And at that time, I qualified. And the difference was that within 3 months, I went from the age of 54 to 55. And at that time, it was 55 to 80. They've subsequently dropped the age to 50 to 80 in certain pack years. But at that time, it was 55. And so when I went back that second time, I qualified, and I was, I scheduled my the CT scan, and it is. It's really simple. You go in. For me, I didn't have it with contrast, so I went in, and I just I laid down on this table, and it's I call it going through the donut, because it looks like a little half, three-quarter shaped donut, and you lay on the bed, and it pushes you in. They tell you don't breathe, and you can breathe now, and then you come out and you go back in, and they say don't breathe, hold your breath, and then you come back out and you're done. And so, that was my experience. The next day, I got a call from a pulmonologist office. I didn't even know what a pulmonologist was, but they wanted to see me ASAP. And I went in, and, at that time, they suspected that it was lung cancer. And so they sent me for a bunch of testing. I had a PET scan, I had a brain scan, I had, a bone scan. I had, a bunch of, I had a hearing test because they wanted to find out if it happened to be cancer and I needed to have chemotherapy. They needed a baseline for my hearing. I had a bronchoscopy, and then after that, I had my surgery, and they removed my upper left lobe, and I had chemotherapy, and midway through my chemotherapy, my oncologist asked me whether or not I wanted to participate in a clinical trial. There was a clinical trial that was it was after I completed my chemotherapy, if I was still no evidence of disease, that I would receive an injection of immunotherapy once a month for 12 months. And because my PD-L1 percentage, for lack of a better term, was pretty high. And so I did that afterwards, and I've been no evidence of disease, ever since. But that's only because really they found it so early. That's only because they found it so early. And I'm just very grateful for that. So
thank you for sharing your story. I hope everyone watching heard how easy it was, just how the screening, it was simple, easy. So thank you for sharing that. Doctor, oh, I'm sorry.
I wanted to just add one thing about anyone who's listening who may have symptoms, or that they've been worried about lung cancer. Yes, we're talking about detecting early is important, and you have a lot more options. But there's a lot more options now, even if the disease is later. So there's this thought or fear that if I'm diagnosed with lung cancer, I'm done. No, you're not done. Even if you have symptoms, yes, it may be later stages, but there are so many options of treatment that is available. And I want to make sure that anyone who's listening is not taking it that if they've developed symptoms, they're done. No, there's so much to do as far as option of treatment, and people are surviving longer and longer after being diagnosed and treated with what Denise described as far as chemotherapy, immunotherapy, and a lot of other options that helps them with regards to improving their taking care of the cancer and living with cancer free.
Thank you. Actually, that was my next question. So you beat me to it. No, that's great. You read my mind. That was perfect. So what we talked about a little bit about the radon. So we've mentioned, or Denise mentioned going to a pulmonologist. What exactly does the pulmonologist do? Because once we hear that, sometimes I think we're a little nervous, like, well, wait, what's that doctor do? And how, like, post-diagnosis, like, can anyone speak to that? Like what that looks like on those visits with other doctors, and just what other doctors are part of the team?
I can speak to that since I'm a pulmonologist. When a CT scan is done, what you see is just a picture, right? You're seeing a picture of a nodule or a spot in the lung. We don't know at that point if this is lung cancer or not. And as a matter of fact, you can find a lot of things when you take a picture of the lungs that are completely benign. And the way that we know something is, in fact, cancer is that we need to have a sample of it. Now, oftentimes the job of a pulmonologist who sees this often is to look at some of the features of what it looks like on the picture and then decide, is this something that should be followed up with another imaging, another CT scan, and let's just say 3 months or 6 months. And this is in collaboration with the radiologists who are expert reading that CT scan. And depending on what that is, they may choose to or make a recommendation of, we may need to be more aggressive. And as Denise described, that the next step may be, other than some additional testing, to have a bronchoscopy, which is a way of going in with a camera inside of the airways and getting near the area where the spot is to actually get a sample. It's the same type of tool as it's used for colonoscopy that people are more familiar with, but it's thinner and it goes through the airway when the person is given anesthesia to be asleep. There are other ways to diagnose and have a sample of that tissue, which could be through a biopsy. That's at the same time when somebody's getting a CT scan, they can have a needle biopsy there. Or there could also be surgical biopsies that can be done if the risk is really high, and that would be when the thoracic surgeons are involved, when the idea is it's not just to go and identify what it is. We have a very strong suspicion that this is what it may be, and it may go the route of a surgical biopsy. And I'll defer to Dr. Woodman to add to that as far as biopsies when it comes to the surgical approach. But there's other aspect of pulmonologists that we take care of symptoms and make sure that your lung function is adequate enough for being able to tolerate a surgery, and that you're afterwards, if part of your lung is removed, you're still able to have a full function and be able to have a quality of life that's acceptable.
Okay, thank you. Thank you.
And I want to just.
I'm sorry. I just wanted to say thank you, Doctor, for coming on. I know you have to drop off, but I just wanted to say thank you. Go ahead, Laura. I'm sorry.
I just wanted to remind everybody watching that this all starts with just your primary care provider. You know, you don't have to see any specialists to get a lung cancer screening. This starts with your nurse practitioner, who might be your primary care provider, your physician assistant, your doctor. That's truly where it starts, and you don't have to see any specialists. I just wanted to remind everybody that having that conversation with your primary care provider is where it all starts.
Okay, thank you. Dr. Woodman.
Yeah, I think Dr. Gandhari really kind of gave you a good overview of the variety of ways of, what you do with that information. And I think sort of backing it up even a little further, as I think, Denise, you gave a really good example of somebody who advocated for their own screening. And I think that's part of the message I think we need to sort of keep spreading the word is patients are really their own best advocates. We can educate the doctors all we want, but you sort of have to ask and then question if because if you think you might be at risk, you probably, deserve a second look. And, the other thing I think you have to counsel patients when they're going for screening is, while in people who have had high risk, either jobs with asbestos exposure, or they've got, known that they've had high radon and that they only discovered later in life, and those are kind of multiply their risks with whatever smoking exposure they get. So, probably the highest risk patients are radon workers who worked with asbestos and smoke. It's very, very high risk. So there are people who have industrial exposures, or they've had job exposures. Could be as much as a summer job doing roofing and insulation, or plumber's assistant 30 years ago puts them at risk of lung cancer. And but the flip side is that the majority of people who get screened, well, they don't have cancer. You find spots, just nodules or spots, probably in about 15% of people who are high risk. And most of those spots are not, in fact, cancer. So it then begins a process of getting additional tests to really figure out, is this a suspicious lesion? Is it big? Has it grown from maybe an old x-ray or CAT scan that they had for unrelated reasons? Maybe 10 years ago, they had a baseline CT, and could have been from a car accident or something like that. And you have to really then put the whole story together, looking at what's the growth pattern. Does it show activity, say, on a PET scan, which would make it much higher risk? And that might lead directly to a biopsy, as opposed to just watching something that looks like a very small spot. And you have to, recognize that not everything is bad, but if you don't look and take those findings seriously and just do the scan but don't follow up on it, it does require follow-up too. And oftentimes you don't find the cancer until the patient's been screened 2 or 3 times over the course of 5 years before you actually come to a conclusion of what the outcome is. So it initiates a process, and you need access really to that facility that's going to give you that. And to some extent, just trying to identify the patients, I think that there's a lot of hope that some of these electronic medical record tools will allow, if somebody puts in the proper smoking history at one point, they're trying to make it, like in our institution, they try to make it very easy for the primary physician or caregiver to say, oh, you're at risk because you've smoked X number of years and you quit 10 years ago, and, you know, really puts it up on a best practice flag almost on their chart. So it does go from the patient to the primary physician, and that's where the conversation really needs to start. And it's about educating both groups of people about the importance.
Thank you. Laura, can you talk a little bit about what you do to help patients as a patient navigator?
Yeah, absolutely. So, as you all might know, based on the screen here, I work for the American Lung Association, and I'm a lung health navigator for our lung cancer helpline. So our lung helpline is, and what I do as a navigator for the lung helpline is basically just anybody that's watching this now or might be watching this late, you know, that's not live and might be watching it later. I'm here to help guide you through the process of just even inquiring about a lung cancer screening, knowing your eligibility. So anybody could call our lung helpline. It's 844 ALA lung, and it's completely free. And basically you talk to myself, I'm a registered nurse, we have respiratory therapists, and a big team of people that could help. But my role is basically, you know, talking about your eligibility, and then once we know if you're eligible or not, you know, getting you to those important community resources. So whether that might be directing you to a free or low cost lung cancer screening program, helping you find transportation, and really answering any questions that anybody might have, any hesitancies, and removing any barrier to care so that everybody that is eligible gets screened. So you could call, whether it's just about eligibility or if you know you're eligible, but now what the next steps are. If you don't have insurance, we're happy to go through that process and talk about that process with you as well, especially with open enrollment, you know, happening right now with insurance. You know, again, talking about removing barriers to care. So really just figuring out where you are in this journey to getting a lung cancer screening and meeting you where you are and answering any questions. And this is completely free. So it's 844 ALA lung, which hopefully we can place somewhere in the chat or somewhere for everybody to see.
Okay. Thank you. Well, I was curious, are there some common barriers that you are normally hearing that people have so that they can't access, or it's causing them not to be able to access screening, or they think it's hindering them from accessing screening?
I think a lot of it stems from just not understanding their eligibility. So, you know, making sure that they understand if they're eligible, you know, if they are eligible or not. And like Dr. Widman said, even if they're not eligible, but they have these other concerns because they maybe have some signs and symptoms and that they think may be something lung health related, you know, talking about how they can advocate for themselves, talking about what their next steps could be. And then the great thing about our program as well is we follow up with our callers. So we, you know, we don't just, it's not just one and done. We don't just have a conversation and then drop them. I follow up with them. Did they get their screening? Once they get their screening, we follow up, make sure they understand their results. If they get diagnosed, we continue to follow up with them and just, you know, being that navigator, that hand to hold, and just kind of talk about what the hesitancies are. So I think knowing their eligibility is one of those barriers, and kind of the hesitancies, the personal hesitancies, like they might be scared of what the results might be. So we talk about, you know, any stigma that might be there, and then really like mistrust in healthcare as well. They've maybe had a, you know, Denise, like you said, and family member that didn't have a really good experience, and financial barrier as well. So really making sure that they have a PCP, a primary care provider. If they don't, we also help, guide them to finding a primary care provider. So really just anything that they might need regarding lung cancer screening.
Okay, perfect. Thank you. Can you give the number one more time? Sorry.
It's 844-ALA-LUNG. So it's 844-252-5864.
5864. Sorry, I'm just trying to type it so I can share that.
So we want to just kind of like
Denise,
fill in, help with any gap they might have.
Okay, perfect. Thank you for sharing that. Denise, as someone that has lived with lung cancer, survived it, can you talk about any of the challenges that you faced on your journey, and what advice that you would have for others going through something similar?
I think for me, one of the biggest challenges I had was facing the stigma, because I felt my diagnosis for me was very isolating, because I felt that because I was a former smoker, people would think that I deserved lung cancer. And so I did not really talk to a lot of people about it, because I was afraid that I brought it on myself. And so that was really difficult for me. I did, in fact, become involved with an organization that provided mentors. And I was able to get connected with a mentor, and she basically she was a former smoker. She had the same diagnosis. We were approximately the same age. We had the same chemotherapy cocktail. We were just the same. And so I was able to talk to her about how I was feeling about the stigma, or maybe it was in my own head, or how I perceived it. And that went a long way for me. But prior to that, I just felt that people would think that because the first thing they say after I say, well, I was diagnosed with lung cancer, is that, well, did you smoke? And it was just difficult until I finally realized that, if you have lungs, you can get lung cancer. I was on a panel one time with this organization, and I think there were like 6 or 7 women, and I was the only one that was no evidence of disease, but I was also the only former smoker. Everyone else was a non-smoker, and they were stage 3 and stage 4. So, I mean, I just, it was difficult for me at first, just letting people in and talking about it. And so I really had to learn how to deal with it from the emotional aspect for me. Another thing for me was making sure that I understood what, I had so many doctor's appointments, and lots of times I couldn't keep it straight. I couldn't keep them straight, and things were happening so quickly, and I was bouncing from one appointment to the next to the next. And what I did was I took a note taker with me, because I may hear one thing, and she went with me to every single one of my appointments, and she would take a notebook, and she would write stuff down that she heard the doctor say, and we would talk about it later. She said, no, the doctor didn't say that. The doctor said this. And so that helped me a lot to keep it straight in my own head. So those were some of the challenges I had. Was just all of the testing was just so overwhelming for me. So that was kind of, for me, my experience.
Okay, thank you. Well, how can we improve education and awareness around lung cancer, and ease those fears of, of going to get screened? What can we do to educate and raise awareness? Dr. Gandahari, since you're still here, we can start with you.
Yeah, I couldn't, this has been such an amazing conversation, and the cause is so important. I appreciate the opportunity to speak about it. The whole aspect of stigma, as Denise was talking about, is so real, and I think we all, as people, as community, we have to recognize that it exists, and we have to attack it head on. We need to talk about lung cancer, just like we're talking about it now. We need to be open to really spend the time and discuss it with our doctor when we're going. We also need to be really open about our use of cigarettes. Because if we, as Dr. Whitman described, if the detail of tobacco use is not clear, electronic medical records or ways that the primary care providers can be flagged that somebody's eligible may be absent. Oftentimes, if we used to smoke a long time ago, we may say, yeah, I quit, and we don't even want to talk about it. Or if a doctor asks you, do you smoke? I would say no. I wouldn't say I used to. I would just say no. And then, there's no more conversation. And so bringing it up is really important. And also, it's important to talk about other exposures. Like if one has switched from cigarettes to vaping, and they're still continuing to get that exposure to whether it's nicotine or the vaping material, it is potentially causing inflammation. It's continuing causing problem that we just don't know about. So I think bringing it up, discussing it, having conversation about it, share with our loved ones, bring it up and talk about it, and also celebrate stories like Denise's, where the story it has led to identification of cancer and treatment and where we are. I think they're very important. And approaching it from the fact that even if one has lung cancer, there is so much hope. So much hope. There's so many options. We can battle together. You're not alone. You have Laura waiting on the phone to answer your questions. There are other programs around the country. We have a lung cancer screening program where you don't have to go to your primary care doctor to actually get the order or determine eligibility. Because oftentimes primary care doctor, when you try to schedule an appointment, maybe weeks or some time ahead because they're very busy. And when you go see them, you have so many questions about other things like diabetes and, blood pressure. And so, time escapes very quickly. And so there are programs around the country that Laura can potentially direct you, which are just dedicated lung cancer screening program. And there's nurse practitioners who go over the risk and benefit. And an important part of it is they do this shared decision making where you talk about it. You talk about, is it a good idea to get the CT scan? You hear about what are the potential risks, because it's not without risks. You get a CT scan, people are worried about radiation. The radiation is very little. It's low dose. It's not enough to cause problems. And then really setting expectations that you can have nodules or spots that are nothing, or that you can have things that we're going to work together and just get another follow-up study. So I think that aspect of being directed, talking about it, improving our access, having program like Laura's and others around so that we can make sure that people can not only get screened, but have a place to answer their question when there is something abnormal, so that, as the fears or the challenges that Denise described, that you have a partner in your care to walk through and help you answer those questions. Because once you hear cancer, sometimes you stop hearing anything else.
Mm-hmm. Yes, thank you. Laura, obviously you're doing the work as well of raising awareness and educating. Are there any other things or anything that you can say to someone watching and, just convince them to give your helpline a call and ease their fears?
I think first, like that first question that was, how can we improve education and awareness? I think, providing community-based education, just like this event, that we are all here now. And this is the reason why we're all here, right? And then storytellers. Then what Denise is doing is so important. Her being here, sharing her testimony, being an advocate now for the Black community and, as a survivor, and to reduce the stigma is huge. And we need more people to to share their story and, be a part of that. So Denise, thank you so much for being here. I think that's huge. But really, I think everybody watching you need to empower yourself with the education that we're providing. And you don't know what you don't know until you ask. So there's no dumb question. I want everybody to call, that number. And really, if you just want to talk about anything that we've talked about today, radon, how to get a test kit as well. We're happy to give you that information as well, because most people don't know about radon until they're either buying a home or they're selling a home. And that's really kind of when it's kind of brought to your attention, and it's because it's being brought to you. You ask your neighbor next door, they probably don't know what radon is, unless that's something that's recently happened. So I just want everybody watching to call whatever question you might have. And we're not going to lead you to any specific health system or anything like that. We want to help you find what's closest to you, what's more convenient to you, and just remove any barrier you might have. But really, no question is too small.
Thank you. And everybody, the phone number is right there on the screen. So make sure you jot that down, or you can always come back and watch it again to catch the number. Dr. Woodman, how about you? How can we raise awareness and education? Oh, are you on mute? Oh, you're muted. That's
I was trying to keep the background noise down. Sorry. No, I think it's about having these conversations, getting advocates for the program. And I've always said that, while probably the biggest impact we can make on lung cancer, reduction is smoking cessation. And anybody who is an ex-smoker who's been treated for lung cancer generally knows other smokers who are at risk, and sharing your story. Smokers know smokers. So they hang together, and share that with all of your friends and loved ones, and even the people who aren't your friends. Just spread the word, because that's the awareness. If you're not going to the doctor, it's going to be talking to somebody who's benefited from the process of screening, and finding it early, and having access. And you have to just continue to communicate that.
Okay, thank you. Denise,
I just wanted to add, I have to laugh because that is so funny, because that's exactly what I did when I was because I'm a smoker. I hang out with smokers at that time. I hung out with smokers. So all of my smoking friends, come here. You need to get tested. That's what, and they did. So it's kind of funny to hear somebody else say that when I did that all along. But I just wanted to add very, very quickly, when I heard the words from my doctor, you have lung cancer, the first words out of my mouth was, I don't want to die. Because lung cancer, the history, I mean, it hasn't been that great. But it wasn't until, as far as survival was concerned, but it wasn't until I started looking at all of the advances that were being made or had been made in the lung cancer community, with research, with testing, with new, clinical trials, that I actually had hope. Hey, maybe I'll survive this after all. Because it's like every other day there's something new going on, as far as treatment or as far as medication. And I felt for myself that it was a time for me to be hopeful about surviving. But it wasn't until I had, done my own research, and I didn't look at all sources, because not everything is created equal. But until I started looking at other things that were going on in the community, and I felt that, that I had hope. And that was a big turnaround for me. I felt that I had hope, that if one treatment didn't work, there'll be something else out there that will help me. And if that didn't help me, there'll be something else out there that will help me. So, I mean, I think with all the new stuff that's going on right now, it's just such a hopeful time in the as a lung cancer survivor. It's just very hopeful. So I will leave anyone listening, anyone who's hesitant, anyone who's afraid. It's very, very, very. There's so many different advances. It's a time to be so hopeful about treatment of lung cancer. So I just wanted to put that out there.
Well, that brings me to my last question, which, you know what, you've answered it, because that's a great way to sum it up. Because my question was, what is the one key message that each of you wants viewers to remember about lung cancer and awareness and screening? And that summed it up beautifully, Denise. But I'll go around the room, and Laura, what is something that you want everyone to remember?
I would say that knowledge is power, and learn your risk factors and take control of your own lung health, your own advocate, and yeah, I'll leave it at that.
Okay, all right, Dr. Gandahari.
Yeah, I want to highlight something that Denise mentioned earlier, and that was when she initially presented to her doctor, they said that she wasn't eligible, and that at the time she was 54, and then the guidelines said 55. What I want you to take away from this is that guidelines and recommendations change. So if at some point somebody told you you're not eligible because of whatever reason, take the information, reach out to Laura, look up about what may be your eligibility. There are various ways to check to see if you're eligible or not, and the guidelines and recommendations change. As it is now, the way that the insurance companies and Medicare and everyone have been following is that quit date that Dr. Whitman mentioned. There are some organizations like American Cancer Society that they have a very strong stance that say quit date doesn't matter. And similar to what Dr. Whitman mentioned, that there are many of his patients who stopped smoking long before, and they still are developing lung cancer. So guidelines change. If someone told you you are not eligible, still keep at it. Talk to your doctor about it. And again, even if you quit many, many years ago, your risk is not zero. It's not gone. You may still develop lung cancer, and talk about it.
Thank you. Dr. Widman.
I think you sort of hit on most of the highlights here, but kind of on the other side of this equation is, we talked a lot about screening and, picking up the early disease, but I think the other side of it is symptoms need to be evaluated. And if you're coughing blood, that's not normal, and that should be investigated. And that doesn't require a whole lot of screening criteria other than getting to the doctor saying, I'm coughing blood and I want an x-ray and a CAT scan, and pursuing that, because just because you have symptoms doesn't mean you're not very treatable, curable. And getting back to the side of a time of hope, the advances in the last 10 years have, for the patients who have more advanced disease, are incredible. We have people who, when I started practice 25 years ago, you would have thought they have stage 4 disease. They'll be lucky if they see the end of the year. I have people like that who are running triathlons literally 10 years later after getting targeted therapy and some of the newer drugs that have happened. And not everybody's a candidate for every drug, but if you go to a multidisciplinary center and you've been diagnosed, you can get a lot of advanced treatments that can really allow people to live very healthy, normal, long lives, even with cancer, not just, being quote cancer free, but they can get treated and be very, satisfied with their quality of health and their activity. So there's hope at all stages, but it starts with getting imaging and getting screened. And that's really the key point.
Thank you. And before we wrap, Denise, did you want to add anything else to that particular question?
Only that the patient is their best advocate. So just make sure, if you're a patient, if you're interested, just be your own, because you are your own best advocate. You have to be your own best advocate.
Thank you. This was great. Thank you, Denise, for sharing your story. And thank you, Dr. Ganahare and Laura and Dr. Widman. This was informative. And everybody, make sure you call up Laura and at the helpline at the number listed, 844-252-5864. That number is there to help you with all the things that Laura mentioned earlier on in the program. But thank you again for joining us. And if you haven't had a chance, make sure you check out part 1 of the lung cancer awareness special. And again, you can find that here on blackdoctor.org on the Facebook Live or on YouTube. It'll actually be under, I think, videos on Facebook, but you can find it. And check out blackdoctor.org for more articles and resources about lung cancer and lung cancer awareness. So have a great night. Thank you guys again for joining us.
Thank you.
Thank you for having
Thank you,
me.
everyone.